Okay, recording now. This webinar is being recorded, so I ask any participants to mute themselves. Hello, welcome to Getting Health Coverage through Getcovered NJ and Family Care NJ. This is being presented by the Plainfield Public Library in New Jersey Citizen Action Education Fund. My name is Eric Stevenson, librarian at the library. The hosts for this event will be Gabrielle and Shalini from New Jersey Citizen Action Education Fund. This video will be up on the library's YouTube page afterwards, okay? So you take it away, Gabrielle. We'll stop sharing right now.
Thank you so much. Just gonna share my screen here. So thank you so much for that presentation, Eric. I really do appreciate it. As he said, we are from New Jersey Citizen Action Education Fund, and today we're going to be discussing the ACA COVID-19 special enrollment period. So this is very exciting news. We do have until the end of the year to obtain affordable health insurance. First, we do have to acknowledge the state of New Jersey. Because of them and the grants, we are able to provide these educational presentations for free. Another component to this is that the state of New Jersey is not responsible for the accuracy of the statements that we're providing. But again, we have been certified in this field, training, and all of our knowledge here is to the best of our ability. So who is New Jersey Citizen Action Education Fund? We're a statewide grassroots organization that fights for economic and social justice. We provide many different free services: healthcare enrollment assistance, free tax preparation, free financial coaching, free first-time home buyer counseling, and free fair housing discrimination. And also, we do have a contract with an oil grill. So if you're interested in any of these direct services, again, all of these services are free. Please follow us on Facebook, Instagram, or Twitter, or you can go right to our website at NJCAEF.org. All right, Shalini, take it away. All right, I'm not sure what's going on with Shalini's speaker, but I will then continue. So the Affordable Care Act, about 11 years ago, this had been completed. And because of this wonderful Affordable Care Act, we've actually been able to make a lot of changes happen in health insurance. So one, it covers people with pre-existing health conditions, including pregnancy, without charging more. So I don't know if you guys can believe this, but before ACA, they were allowed to charge you more just for having a pre-existing health condition, not anymore. All right. It also provides free preventative cares. It gives young adults more coverage options. It holds insurance companies accountable for rate increases. So again, before this wonderful Affordable Care Act, insurance companies were able to just increase your insurance with no cause. They were just able to do this. So we are very grateful for the Affordable Care Act. Shalini, have you returned?
Yes, I am sorry for the glitch before.
That's all right. So I'm going to go on to the next slide for you, okay?
Okay, so take charge of your health. Before we go on further for healthcare, we need to know three major things: why, what, and how about healthcare. Now, why do we need healthcare? Of course, everything is going fine with us, but we never know what can happen when anything can strike. I am walking today, I can fall, break my leg, and it's going to cost me a lot of money if I do not have health care to see a doctor. So of course, to save money, we need healthcare. We also need healthcare to keep in check our health, where we are. For this, we need preventative care. Like Gabrielle said in the previous slide, ACA provides free preventive checkups. So if we have healthcare and we have ACA, that checkup is absolutely free of charge for the year, and we can see that we are at our best health at all the time. Now, before we take a plan, we need to see that what is my need? Do I have an existing condition that needs to be taken care of? Or I just want to make sure that I stay healthy and fit like I am. You will also see what are your choices. So later you will see that you will have many plans to choose from. You also need to see how much can I afford. So this is what I usually say. Before we go ahead and start choosing our plan, make a budget from your monthly income, that how much you can keep aside towards healthcare if you need to pay anything. Next slide, please, Gabrielle. Now, when can you enroll? So with COVID special-19 enrollment, we are this year able to enroll from February 1st, 2021 until December 31st, 2021. Usually none of the plans, none of the healthcare enrollments are available after February, but especially for this year, this is a special provision. How the coverage goes, if you enroll by July 31st, your effective coverage will be from August 31st. If you enroll by August 31st, your coverage will be effective from September 1st, 31st. If you enroll by September 30th, coverage will be effective from October 1st, and it goes on like that.
Here are some insurance options. And again, we're going to be discussing the affordable healthcare options. So first, we're going to go over New Jersey Family Care and its Medicaid program. You can apply for New Jersey Family Care all year long. If you're under the age of 19, you will qualify for CHIP. If you're between the ages of 19 and 64, you would qualify for the regular Medicaid program. And there are in some cases where if you are older than 64 and you are disabled, you can also qualify for Medicaid. What's the worst that can happen? You sent out an application. It is worth at least trying before you tell yourself that you do not qualify. At least sign up and fill out an application. So let's go over our New Jersey Family Care eligibility. You must be a resident of New Jersey. You must be a US citizen or a qualified immigrant. That means that you have to have a status, your immigration status, for 5 years or more. Based off this health insurance is based off of your household income and size. So you can do two things to apply for New Jersey Family Care. You can go directly to their website and you can apply through there, or what I do advise most people to do is to apply through the Getcovered New Jersey portal. If you apply through the Getcovered New Jersey portal, it is a marketplace. It will send your application to New Jersey Family Care if they feel like you're eligible. So if all of these things are something that you know for sure, hey, I know I definitely qualify for New Jersey Family Care, go through Getcovered New Jersey. When you go through Getcovered New Jersey, it is a marketplace. It has Horizon right now, AmeriHealth, Oscar. These three health insurances do have different categories. We have bronze, gold, silver, platinum. So in the event that you do not qualify for New Jersey Family Care, Getcovered New Jersey will provide you with other health insurance options. You can also receive financial subsidies to pay your monthly premiums. And if you decide, hey, I need some assistance, there is no extra cost to you. Again, there is no extra cost to you. I do suggest you get an assister or some sort of representative to just help you fill out the application. Some of those questions can be a little tricky. However, the system is user-friendly. So if you decide you want to do this on your own, you are more than welcome to. You can go to newjersey.gov/getcoverednewjersey. And if you are looking for an assister, you can always reach out to New Jersey Citizen Action Education Fund. I will be glad to assist you for free. Now, due to the American Rescue Plan Act of 2021, there are so much more financial assistance to reduce your monthly payment now. So this came with our last stimulus check. So that was in about April. So in April, they made all of these changes to now provide us more financial help. So for existing consumers, this means if you currently applied for health insurance and you just haven't done anything with it, you haven't picked your plan yet, resubmit your application and see if there's any new financial help for you. For new consumers, or let's say you signed on last year in November when open enrollment actually first opened, you didn't like how much your monthly premium was, you might qualify now. So even if you know someone who did apply earlier on and it just wasn't affordable, let them know that all these changes have really made an impact. And now people are paying $1 for health insurance, $20 for health insurance. So you actually might qualify now and you might really, really like what the new financial subsidies are providing to you. Now for the unemployment compensation, this is amazing news. You are now nearly eligible for free coverage. I helped someone today. They were paying $200 for a family of 2 for health insurance. And with this unemployment compensation, this new benefit here, they are now paying 67 cents. So it's super important that if you know someone that is just feeling a bit discouraged about applying for health insurance, let them know about these amazing new changes at the Getcovered New Jersey marketplace. Now, of course, in order for you to receive this benefit, you must answer the question about unemployment in the application. Okay.
All right, so what is COVID-19 special enrollment that we have been talking about? Like I said, it's a special enrollment period just for this year because of this pandemic. State of New Jersey has opened up for us. So how do we get eligible, or who is eligible for that? Any resident of New Jersey who does not have any insurance coverage can apply for special enrollment. Any person residing in New Jersey who is a dependent. So let's say the head of household does get coverage from the job, but the job doesn't give coverage to the family. The family can apply for special enrollment to Getcovered New Jersey. Or if you have a plan under Getcovered New Jersey and you want to change your plan, even then you're eligible to get benefit of this coverage. You do not have to have a specific document for COVID-19, or you do not have to be directly affected by COVID-19 to avail this benefit. There is another special enrollment period called special enrollment period itself, which is effective again from February 1st, 2021 to October 31st, 2021. Now, what's the difference between these two enrollment periods? COVID-19 is only for this year, one thing. Special enrollment period is usually available after the open enrollment closes for people who have these qualifying life events like loss of a job, change of an income, change in immigration status or citizenship. So someone did not have a proper immigration status before to apply, but now they acquired and it's after the open enrollment, they qualify for special enrollment period. Similarly, is for a death of a spouse or married adoption of a child. If you're new to New Jersey and it's out of enrollment, open enrollment period, you can apply for special enrollment period. Very new and very important this year is pregnancy. If you got a good news that you're pregnant now and you suddenly see that I do not have a coverage, I have not have any coverage so far, you can apply under special enrollment period for Getcovered New Jersey and you can definitely get benefit. Also, if like Gabrielle said, if you no longer are eligible for NJ Family Care, let's say you were getting a benefit under NJ Family Care and suddenly with God's grace, you are able to make more money and then you are not eligible for NJ Family Care, you can still apply for Getcovered NJ under special enrollment period. Next slide, Gabriel. So very important. For this special enrollment period, we need to enroll under this deadline, 60 days from the major event. So most of the event that I said at the last slide, you need to get enrollment done within those 60 days of the event. Excludes is the pregnancy, change in income, or a death in the family. In those cases, you can report after more time also, and then you get a retroactive coverage. Next slide, Gabrielle.
So the advanced premium tax credit is one of the financial subsidies that we can receive to lower our monthly premium. So it is a tax credit that you take in advance. It is so incredibly important that when you are providing your yearly income, that you are being as honest as possible. Remember that this financial subsidy is connected to your taxes. Therefore, when you're filing your taxes, you have to be honest about how much assistance you received. Okay? If you want to avoid a penalty, it is so important that you are honest about the income that you are receiving. So the amount of your premium tax credit depends on the estimated household income. Based on your final yearly income, you will have to pay back the excess fee if for some reason they find that you have lied in your, if you have lied on your yearly income. Now, let's say you have, you lost income and the amount that they credit you is actually a lot less than what you thought you were going to be receiving, then you might even get the difference back. It is so important to be honest when you are filling out your application and you are inputting your information about your yearly income. So learn what your benefits are and how to use them. So here's some health insurance language that I think it's really important for all of us to know before we officially purchase our health insurance. Number one is your premium. The amount, it is the amount that you pay on a monthly basis. So that premium is that monthly payment that you're going to be paying for every month. Make sure you understand what your premium is. Your deductible, it's the amount that you must pay before the health insurance plan really begins to kick in and start paying for those services. Some exceptions are those free preventative cares that we talked about earlier in this webinar. But for your deductible, it's really good to know what this amount will be, because again, your health insurance is not going to start kicking in that much until this deductible is met. So we are in the middle of the year. If your deductible is $2,000 and your copayment says that you have a $20 fee after you pay your deductible, make sure you take a look at what that deductible is and if it's realistic that you will be able to pay the deductible before the end of the year. There are possibilities that we don't pay our deductibles at the end of the year. Just know that this does renew on a yearly basis. Now, your copayment. It is a set fee that you pay every time you see the doctor. That can be $5, $10, $20. Again, just know what copayment you think that it's best for you to pay every time you see the doctor, and let your representative know what type of copayments you are looking for. And lastly, we have our co-insurance. Our co-insurance is a portion of the cost you pay for care after you meet your deductible. There is a yearly limit to what you or your family would have to pay. So in some cases, what you'll see is a 10% or a 20% co-insurance. What this means is that the insurance will then pay 80% towards that bill, and you have to cover that 20%. If it says 10%, then the health insurance covers 90%. Really important to know what your benefits are and to ask these questions. What is my premium? What is my deductible? What's my copay? And what are my co-insurance, if you do have any?
Now you have health insurance. Where do you go for care? So we got everything. We got our health insurance checked. We got our card. It's time to go for a doctor. You have a neighbor who has been seeing a doctor and they say, this doctor is very good, I recommend them. Before you jump and before you make that appointment, please make sure that that doctor takes your particular insurance. How do we check it? You can call your health insurance company. Usually the number is on the back of the card. You can always call them, give the name of the doctor, name of the facility, and they would be able to let you know if that particular doctor is covered under your insurance or not. You can check the insurance website and see there is a section where you can search for the name of the doctor, name of the facility, or sometimes the phone number. You can check if that particular doctor is or that particular facility is covered under insurance or not. Or you can call the doctor's facility you want to see and you can ask them, this is my insurance, this is my coverage, do you take this or not? It's very important, like Gabrielle said, it's very important for you to know what your benefits are and use them wisely to get the most of it. You need to know what your plan will pay. So every time you will say, you will call the doctor's office, they will say, this is in network, that is out of network. What does that mean? In network simply means that this facility or this doctor has a contract with your plan or with your provider. Out of network simply means that this doctor or facility does not have a contract with the plan that you have. I would highly recommend to stay in a network to get best of your benefit and to get the most for your money. Now, some specialists do need a referral from your primary care doctor to see them. It's always good to get the referral from your primary care doctor to avoid any conflict. On the card, sometimes it says PCP Specialist. What does that mean? PCP simply means your primary care provider, the doctor we normally go and see for our basic needs, or the doctor that we see for our yearly checkup. Specialists are the doctors who are specialists who do specialize in one particular area, like cardiologist, neurologist, and so on. Now, this is how your insurance card will look like. It's just a picture. Your card will be much smaller than this. It will have a member's name, like the letter A says, that's member's name. Then you will have what kind of coverage it is, PPO, HMO. There will be an ID with some numbers and alphabet on it, a group number. It's important that you know where your ID and group number is. This is what you will tell when you are calling your doctor's office. They will ask for group number and ID for you to confirm that they are covering your particular plan. Then it will have how much copay you have to pay for a PCP or primary care physician or specialist, urgent care. Most of times you will have PCP and specialist information right on top of the card. So you will know beforehand, before you're going, that how much you are supposed to pay to this particular facility. It will have RX bin is nothing but your medicine prescription. And at the back of the card, you will have the number of the insurance company to call. Next slide, please.
So I want everyone to remember, ask yourself 3 questions: the why, the what, and the how. Why will help you stay motivated. What you need will help you stay grounded and focused. And how much can you afford will help you not to become overwhelmed when you see all the options that you do have. Number 2, be honest when reporting yearly income. Incredibly important to avoid any type of penalties. And lastly, maintain your health and obtain affordable health insurance. At the beginning of the webinar, I did talk about the free services that we do provide to the community. Again, we have free housing, rental and foreclosure counseling, financial coaching, healthcare enrollment assistance, tax preparation, reporting housing discrimination. So if you need any of these services, this is all the contact information here. Shalina and I provide free remote appointments to assist anyone who may be in need of assistance during obtaining affordable health insurance. Let's say you just have questions. Let's say you've already applied and you're having some difficulty. If you're still pending on a New Jersey family care application, whatever your healthcare needs are, we can and we will assist. My name is Gabrielle Escribano. I speak English and Spanish. My phone number is provided.
My name is Shalini Rajput. I speak English and Hindi, and my number is 973-745-8307.
And if you need to reach us, you can always reach us at getcovered@NewJerseyCitizenAction.org. Thank you so much to the Plainfield Public Library for allowing us to present on these very serious topics.
And thank you, Gabrielle and Shalini, for doing the presentation. For anybody who wants to see the presentation afterwards, they can go to our library website. Hold on. You can go to our website, and at the bottom of the page, you'll see the YouTube link, and it'll take you right to our YouTube page. You can also contact the library at 908-757-1111, extension 112. Or you can contact us at REF or ref at plfdpl.info. Once again, that's REF or ref at plfdpl.info.
Thank you so much, Eric, for having us, and I do hope you enjoy the rest of your day.
Okay, you too.
Thank you, Eric.
Okay.